You're good.
All right, Jacob. Well, nice to have you here. How can we help you?
It's just I've had for probably, I think like 3, maybe 4 months, I've just had bicep problem that I can lift it and do stuff, but it hurts.
Okay.
So, not like really bad, but it's just not gone away, so.
And how long ago did this start? You said in the last few months, or?
Yeah, I think it was like 3 or 4 months ago.
Okay. Do you remember doing anything specific that had the pain start on?
I lift weights a lot, and so some of the things I do, I figured like some kind of jerking or something like that. But I've had that, I don't know. I had my left bicep. I had like a little twinge once, and it was like the next day I worked with this chiropractor who couldn't do it anymore because he had arthritis. And I mentioned to him, and he just did this real quick thing and just fixed it. So I was thinking it was something similar to that. I don't know.
Okay. And so, if I remember, if I understand you right, it wasn't like a one time you just felt it, pop or something like that. It just kind of gradually got worse and kind of stayed the same. Okay. Now, can you show me where it's causing you some pain? Like exactly.
Yeah, it's kind of on the outside, and then I can feel it like on that muscle.
Okay.
But it's mostly on the outside.
Okay. All right, just right in here, right in there. Okay, can you explain how it feels?
It feels fine. Like right now, can't feel anything. But when I go to the gym and I'm doing curls or whatnot, that's when it starts to hurt, and it's always when I'm doing motions like to the side.
Okay.
So.
And explain what it feels like when it does hurt. Is it kind of achy, sharp pain, or how would you describe the sensation?
I wouldn't say it. Man, it's tight. I can't really, it's not a sharp pain because I can still work it with it. It just feels like maybe something's being pulled.
Yeah. Kind of hard to describe sometimes, I know.
Yeah.
But, so do you feel like it comes on pretty easily when you're at the gym, like early, or does it take a lot of work to get up to the symptoms coming up?
It comes pretty easy.
Pretty easy?
Pretty quickly, yeah.
Okay. And how severe are your symptoms? Like if 10 was the worst pain you could ever imagine and 0 was no pain at all, on a 0 to 10 scale, where would you put it?
3, maybe 4.
Okay. So that is worse 4, usually around 3.
Yeah.
Okay. All right. And have you found anything that you've been able to do that'll ease the symptoms when they come on?
No.
Probably rest. Does rest help it, or?
Rest, yeah. But I mean, it really doesn't take a whole lot to, because I work, I lift stuff all the time at work. And
what do you do for work?
I'm a mechanic.
Okay.
Somewhat. I wouldn't call myself a mechanic, but I work at a dealership.
But you're using your hands a lot, and.
Okay. I carry a lot of stuff there.
Okay. Now, have you noticed, along with this pain, have you noticed any pain in your neck at all, or in your upper back?
I would say no, but I mean my shoulders have been starting to feel a little, mainly my shoulders have been feeling a little tight.
Okay. Just up in this area, or where do you feel the tightness in your shoulder?
Like last week, and I think it was just soreness, but it's sometimes back here, but mostly it was just like the whole thing just felt tight.
Okay.
But I work out, so sometimes it's just sore.
Yeah, it's just soreness from working out.
Yeah.
Okay. And then, have you seen any other healthcare professionals for this? On your left side, you saw a chiropractor, but for the right side, have you seen anybody else? Okay. And did Levi tell you anything about physical therapy, what we might be doing here?
I asked him. Yeah, I asked him about it. I was like, he kind of recommended you guys just trying out, but it was just something I was like telling him. I'm like, I don't really know, and I kind of passed it off, and it's like I find him kind of in a position where I can see about getting taken care of.
Okay, so he didn't mention any specific treatments that we might do, or?
I think massages or acupuncture. Those kind of things, yeah.
Cool. Yeah, we can describe all that later to you. But and have you ever had physical therapy for any other condition? No, it's your first time.
Yeah.
So as far as expectations in your own condition, how do you feel? How do you feel we can help you? Do you feel like you're pretty confident that we can get you better? Not quite sure.
Somewhat. Yeah, I'm sorry. I'm always a little skeptic, but
Yeah.
other than that, I'm definitely willing to give it a try and see what happens.
Well, you're definitely in the right place. We see this kind of thing all the time.
Okay.
And so we'll do a kind of more of an objective exam just to see what we can find in your symptoms, and we'll see what we can do for you.
Okay.
Okay, thanks.